Good morning, everyone. My name is Jacqueline Bale, and this is my 3-minute thesis presentation. And my focus for my 3B paper was parental resistance to kangaroo care implementation across the globe. So, just to start off, kangaroo care is the skin to skin contact between an infant and mother. The infant lies naked against the mother's bare chest. So, while kangaroo care has been recognized by the World Health Organization as a non invasive and non pharmaceutical intervention with maybe many favorable outcomes for infants and mothers, including stimulating breast milk production, increasing the mother's confidence to take care of the infant, bonding, pain management, um, vital sign stabilization, etc., there exists parental resistance to implementing its practice in NICUs across the globe. So, parental resistance to kangaroo care is a pediatric health challenge because preterm infants could experience reduced pain from painful procedures if kangaroo care is utilized more. So, therefore, the parental influences against kangaroo care must be addressed. Common resistance themes to the intervention include parental knowledge deficits, parental biases and negative emotions around kangaroo care, negative cultural influences, a lack of community support towards the parent, and a perceived lack of support from nurses, and also a lack of privacy expressed by parents. So, while the successful implementation of kangaroo care in the NICU environment is also influenced by healthcare staff, understanding and accepting its practice, my focus will be just on the parental reasons for resisting kangaroo care participation. Um, so, to elaborate a little bit more, some of the things that influence parent participation in kangaroo care um, include not understanding the benefits of kangaroo care. Um, so that would be a parental knowledge deficit, parental biases or mental health concerns. There's feelings of shame often expressed, as well as anxiety, guilt, and depression when a family gives birth to an infant that needs to be in the NICU due to preterm delivery. Many studies have reported parents worrying about hurting their premature infant, so they're very resistant to touching the infant. Infant is in a very fragile physical state with lots of cords and lines attached to them. There are cultural influences such as traditional confinement time, practice postpartum, which acts as a barrier to practicing kangaroo care. And in some countries, there's resistant to carrying the infant on the chest because traditionally the infant is carried on the mother's back. So, moving on to lack of support, family members might also have a knowledge deficit about the benefits of kangaroo care. So, influential family members might disapprove of the intervention, and if a family who is in a vulnerable state, just having this experience of having an infant that's in the NICU ward and they want to participate in kangaroo care, if they perceive that they feel that the nurses are not supportive and that they're more of a nuisance because they're asking, can you help me position the infant on my chest so that I can practice kangaroo care, they will be resistant to actually implementing the kangaroo care practice on their own. Lack of privacy. Multiple parents have been interviewed and stated that they don't feel comfortable practicing kangaroo care because they feel very exposed. So, these nursing implications, how will this inform nursing practice? Nurses can support parental acceptance of kangaroo care by performing relational practice with the parents and using gentle inquiry about what influences or hinders their participation. And by listening to their concerns, fears, and questions, nurses and the parents can work in partnership to address the barriers that parents experience in performing kangaroo care.